Hello, everybody. Welcome into Talking Fitchburg on this Monday, January 24th, 2022. Jeremy Crosby here in the frozen tundra I call the basement. And Andrew is in, well, today, mysterious place on an island, somewhere warm. At least that's what he's wishing. I am too, so that's why I say that. Welcome in. Hope you had a great weekend. Hope you got to enjoy some of that snow. I know I did, because I had to shovel it and snow blow it and have to go back out and shovel it again. But for those of you who enjoy the outdoor stuff, which I do, I hope you got outside and enjoyed it. There were plenty of opportunities to go around and have some winter fun, and there's still a lot of winter fun activities coming up too. Check the area for some fun. Oh, I'm going to go ahead and turn that off, Andrew. Nothing like a professional show to get things kicked off here today on Talking Fitchburg. We'll get you the latest on headlines. You know what I miss is the kids playing in the background. That's what I miss. So back at school, back at daycare. Usually like, hey, you tie it in when Carson would throw something or Lily would yell at Carson, or you're like, oh yeah, that's the story they like. I don't have any of that. It's me making a fool out of myself every day, but that's a different story. We'll talk about our update today. It's a special one. I'm going to be breaking some news today right here on Talking Fitchburg in our monthly update of Fact TV. We'll have that coming up for you. And we'll talk some health today and digest. Got a couple of stories related to vaccine and getting the most out of your mask. Plus, talking radon too. We talked a little bit about last week. It's National Radon Safety Week. So I'll get some of that in there as well. Talk about testing, a little bit on that testing side. So if you want to test for radon, you know how to do it. We'll have that for you coming up in just a little bit of time. But first, we'll get to the headlines. And we start with the job openings. We got a few of them right now. Some are new, some are vacant. And we just want you to come join our team. All right, here we go. We start with the administrative clerk, a new position coming on board here. Love you to join the team. They're going to be helping out everybody, including human resources. You've got the associate planner, case manager, the case manager we have is moving to the case manager with the police department and senior center. So we're excited about this. So come join our team at the senior center. Environmental project engineer, fire science intern, GSI coordinator. How about the outreach librarian returning back? Paid on-call firefighter and a police officer position just opening up here. And we'll have a couple more of those coming up down the road. But that is where they're at, fitchburgwi.gov. So we can fill out the application and sign up for one of those great opportunities. You even might be able to get to meet Andrew. And I'm not selling him short. He's a good dude. So that's a perk right there. It's not even in the contract. It's just an automatic perk. You didn't even know. Let's talk about snow removal and sidewalk. Nobody ever wants to meet me. They want to know this Andrew guy. Snow removal. Andrew, have you cleaned your sidewalks off? No, because he doesn't have any. But for those of you who do, here's what that says. Section 27-144, snow and ice to be removed from sidewalks. The owner of each lot or part of a lot shall remove or cause to be removed all snow and ice which may have fallen or accumulated upon the sidewalk in front of a premise which he or she owns, not later than 6 p.m. of the day after the same has ceased to fall or accumulate, provided that when the ice has formed upon any sidewalk that can't be removed, then the owner shall keep the same by effectively sprinkling some sand, salt, or other suitable substance in such a manner as to prevent ice from being dangerous until such time as it can be removed, and then it shall be properly removed. That's what it says in the statute. So make sure you get that cleaned off by 6 p.m. the following day if you do have sidewalks that you're responsible for. Also, mailboxes. If you have a mailbox and it's been hit by snow and knocked off, well, we have guidelines along this. So snow removal operations occasionally do damage mailboxes if the mailbox was installed and maintained according to the current city standards and was damaged from being struck by the snowplow. Public Works may repair the damage, or you may receive some reimbursement if the case falls within the city's mailbox damage policy. If the mailbox was not constructed or to the current standards, the repairs will be the homeowner's responsibility. To report a damaged mailbox, either call the Public Works line at 608-270-4260 or email publicworks@fitchburgwi.gov or use the Report a Concern button. It's on the left-hand column of the city's website. All right, there's still a need for blood out there, and we want to make sure that you have a chance to donate. There's another opportunity for you right here in Fitchburg. Blood Drive is going to be at Black Hawk Church, 5935 Astor Drive, and is hosting a blood drive on Tuesday, January 25th at 10:30 a.m. to 3:30 p.m. For an appointment, you need to call 1-800-733-2767 or visit redcrossblood.org. You can enter the sponsor code Blackhawk. And if you want to learn more just about donating blood more, check out the Red Cross's website. You can find even more places to donate blood if tomorrow isn't convenient for you. But another local one, and appreciate all the local businesses who are helping out with this and donating. And if you've watched our segment, Andrew Bramlett says it's easy. So go ahead and donate today if you can. Badger Prairie Needs Network is going to be hosting a vaccine clinic. This is going to be coming up in February after success of the first vaccine clinic says. We are excited to announce that we'll be running another free COVID-19 vaccine clinic. Mark your calendars for Monday, February 14th. Well, that sounds like a really familiar day. From 5 p.m. to 7 p.m. at the Badger Prairie Needs Network. No appointment is needed. They'll have the Pfizer, Moderna, and Johnson & Johnson available while supplies last. No ID or insurance is required. Everyone 5 years of age over is welcome. And 15 to 17-year-olds need a parent or guardian to be present. First, second dose, or booster doses. If you receive your first dose of the series, second dose of the series, or boosters, whatever is needed, there is no appointment needed. And vaccines will be administered on a first come, first serve basis. So mark that on the calendar for the 14th. I can't think of a better way to celebrate Valentine's Day right there than getting the vaccine. All right, turning our attention to Better Business Bureau, and they're saying be careful before you download that app. How to avoid app store scams. That's right. Your store important. Let me start that again. You store important personal information from passwords to banking details on your phone. Unfortunately, scammers are lurking. Dun-dun, dun-dun, like that. On the App Store of Apple or Google. To avoid getting scammed, Better Business Bureau recommends the following tips when downloading an app. How to download apps safely? Well, number one, only download apps from official app stores. Yeah, trusted app stores don't completely eliminate the threat of app scams, but they do offer basic level of protection. You are much more likely to download an app that will send spam messages or expose your phone number if you download it from an unofficial or little-known app store. Don't rely solely on the high star ratings when deciding to download. Keep in mind that shady app developers can generate or purchase fake reviews. One telltale sign of a scam is when an app has thousands of 5-star reviews with no written comments and hundreds of 1-star reviews with negative comments. App developers may have purchased the good reviews to cover up the bad ones, thus exposing them to fraud. Even written reviews can be purchased, though, which leads up to the next tip. Read good and bad reviews. Super important when you're downloading. Scammers can artificially push good reviews to the top of the list by getting fake users to make them as helpful as possible. Yeah. What do you know? They can also pay people to create written reviews claiming the app is great. So take a closer look. I love reading the negative reviews. In fact, that's all I'm looking for when I go and look for an app. I'm looking at the negative reviews, to just read through the lines, like to see if how upset they were, what were some of the key features that were wrong. Because some people are like, well, the app is terrible. Well, what does that really mean? What's terrible about it? Give me some pointers. I do that with anything that I'm purchasing. So something good to think about. Also read the app's privacy policy before you download. Take a few minutes to read the app's terms of service and privacy policy to make sure your personal information on the app and how they access it or how they will use that information. So important to do that because, well, you know why. And make sure you download the real version of any app you look for specifically. One popular tactic scammers are using is creating a copycat app to trick people into downloading. So make sure you're downloading the right one. Keep eye on free trials. A lot of game apps have this where you have the free trial to try it out. And then they go ahead and charge you. Scammers will help you sign up for a free trial and then forget to cancel. Many scam appers charge for weekly instead of monthly subscriptions. Yeah, you got to watch out for that. There are more tips and ways to be safe. I suggest you go here. the Better Business Bureau website and use the scam tracker. That can help you see what's out there and making sure that whether you did or didn't, you should report it, but you can also keep up on the latest. And they have a lot of other great tips out there as well. bbb.org/Wisconsin, or you can call their number. It's on the screen. And we appreciate the Better Business Bureau helping out, sharing those great tips. And of course, Andrew will share the link, as he always does when he posts up the headlines, so you can go check that out on your own. All right, that does it for headlines. Coming up next, we're going to be talking about your health between COVID and radon. Thanks right here on Talking Fitchburg.
It takes all of us to slow the spread of the coronavirus, so follow guidance from authorities where you live and stay home unless absolutely necessary. Use a delivery service for essential items like food and medicine. If you must make essential trips, stay 6 feet apart from other people. Wear a cloth face covering and wash your hands for at least 20 seconds as often as possible. Visit coronavirus.gov for the latest information.
We're all just trying to keep things running for those who rely on us.
Ready!
That's why we don't have time to be sick with the flu. And especially this year, no one has time to get sick. Get a flu shot for yourself and those around you too.
Welcome back into Talking Fitchburg. Today's digest is called Your Health and You. Actually, I was trying to come up with a good name before and just didn't come up with one, but Your Health is what I'm going to call it, at least for today. We'll come up with a better name down the road for this digest segment, but something I want to get in here. We talk about health stuff all the time, but doing a segment about it's kind of fun. Let's dive into this. First one, Andrew, is COVID-19 Wisconsin data by vaccination. This is very interesting statistics coming out. Let's take a look. Even as cases continue to increase rapidly due to the highly transmissible Omicron variant, vaccines and booster doses remain highly effective at preventing severe illness, which is good. Hospitalization, and death from COVID-19. And this is the interesting piece here on the numbers. This data coming in over the week says age-adjusted rates among people who are not fully vaccinated compared to fully vaccinated. So that's how this breaks down. Diagnosed with COVID-19 is at a rate of 3 times higher. Hospitalizations with COVID-19, they're at a rate of 10 times higher, and died from COVID-19 at a rate at 14 times higher. On average, fully vaccinated people are less likely to be infected, hospitalized, or die from COVID-19 compared to people who aren't fully vaccinated. And it doesn't matter how bad COVID is or isn't, or how, being vaccinated is what's recommended, and data continues to show the benefits of doing so. And you still got to follow the other things. So the mask up, stay 6 feet apart, wash your hands, all things that are a part of this. And specifically talking about the masks, I think there's been a lot of questions and a lot of stuff that's come out recently about masking. And I just wanted to read this. We had this in the show before, but I thought if we could just take a little extra time today to talk about it. So let's talk about each one of these really quickly. The N95, there are respirators approved by NIOSH in the US that filters out 95% or more of small particles. This is what healthcare workers wear when working with patients with highly infectious illnesses like TB and COVID-19 patients. You might also have worn these before COVID when dealing with dust during DIY projects. These approved N95 respirators haven't been tested for broad use in children, though. And I don't know that I know the KN95s they make for kids. I don't know if they make those big ones, the N95s. Andrew, you know that at all? Have you seen any N95s with kids? I don't recall seeing any, but doesn't mean it's not out there. But that's why they're the most effective. And I can remember at the beginning of the pandemic where they're like, don't buy those, give those to our healthcare workers so they can stay safe for helping us. And now the tables kind of turn as we've caught up. But this variant certainly transmits a lot easier, and thus why the stepping up the mask coverage here. So the next question, I think, which has been for everybody, including myself, is what's the difference between an N95 and a KN95? the KN95, the Chinese equivalent of an N95 mask. They are similar filtering properties to an N95, but they're not tested as regulatory by the NIOSH. So they are usually shaped like a clamshell with a vertical seam down the center. I have one of these. We bought in a couple of these here at the Crosby household. They work great. I was actually telling Andrew that it's easier to breathe, I feel like, with when you're wearing these, and don't hurt as, I don't know, they just fit. So another good option. How about KF94? Now we're really opening it up here. This is the Korean equivalent of the N95 mask, just like the KN95s. These have similar filtration properties as the N95, but they're not tested regularly by the NIOSH. They're often shaped like a boat with two horizontal seams. I've seen these before. They're out there. Surgical masks. These are not as protective as the masks listed above, but they are lightweight and easy to breathe in. Surgical masks offer more protection than cloth masks. You can wear a surgical mask under a cloth mask for more protection. I say it again. You can wear a surgical mask under a cloth mask. So using that double protector gets you a little bit more protection, not as much as maybe the KN95 or N95 or KF94, but something to keep in mind. Cloth masks. Now it's saying we do not recommend only wearing cloth masks at this time unless you do not have a better option. Well, cloth masks are better than nothing. They don't provide as much filtration as of any of the other options listed above. However, you can use cloth masks on top of a surgical mask to get better fit for your surgical mask. So kind of works out good. So hopefully you've been stocking up when you can on the different types of masks. I know it's going to be kind of difficult. We still got it where everybody can get free masks right now, and there's a lot of those being distributed with profits across state counties. So we'll keep sharing as we hear about them, but they are out there. We want to keep you protected. So glad to have a chance to actually break that down. All right, switching to Radon. Radon, is your home radon safe? Andrew's got a graphic here that'll help us kind of talk about what is radon and what are we talking about here? 1 in 10 homes, they got it. And in fact, in Dane County, it's pretty high overall. We've seen that in the past, so something to keep in mind. And we want you to stay protected. And the fact sheet that will help you understand why it's important to have your home tested. So if you don't have a radon system, you're probably going to ask, well, what do I need to do before getting one? And the first thing is testing to see if radon is in your home. So let's go to that. There are two different types of tests for radon testing. First one is a short-term test or short-term testing. It's the quickest way to test with short-term tests. Short-term tests remain in your home for 2 days to 90 days, depending on the device. Charcoal canisters, alpha track, or electronic ion chamber continuous monitoring. The different types there detectors are mostly commonly used for the short-term testing because radon levels tend to vary from day to day, season to season. Short-term tests is less likely than a long-term test to tell you your year-round average radon levels. If you need results quickly, though, however, you can take that short one and at least then maybe take another one down the road to get repair. Also, long-term testing. Long-term tests remain in your home for more than 90 days. An alpha track or electric detectors are commonly used for this type of testing. A long-term test will be giving you readings that is more likely to tell you if your home's year-round average radon level is better or understands better than the short-term. I did a short-term test. There are other rules that apply, which you need to read because it says, place it in the basement. But if you do like laundry and stuff, it says don't put it near the laundry. Well, a lot of people do laundry in their basement. So make sure you read into that. We'll try to share the link out for this as well so you can check it out. But just doing some home investigating, that's what it's all about. And again, we just want to keep you safe. Andrew and I's job is to keep you safe, or at least tell you about safety items because we love safety. Well, I don't even know if Andrew actually likes safety. You like safety, bro? He does. So just because I speak for him doesn't mean he agrees with me. All right, we'll take a quick break. Coming up next. Sometimes I wish they could always hear you, Andrew. I know these times we can't always hear you, but someday we'll get there. Coming up next, we're going to open up and talk about why Jeremy's working next month. No, we're going to talk about Fact TV, your monthly update, and breaking some news next right here on Talking Fitchburg.
You could be spreading the coronavirus without realizing you have it. So follow guidance from authorities where you live and do your part. It's important to limit in-person interaction with anyone outside of your immediate household, but phone and video chat are safe ways to connect. It's also important to limit any social gathering. This advice applies to people of any age, including teens and younger adults. Visit coronavirus.gov for the latest information.
After you joined our family, it was like, I really do feel complete now.
Brandon met a girl on a dating app. He finally found the courage to ask her out. No answer. He started to panic. Was he being...
Hey, sorry I didn't respond. I was driving.
She must be a keeper.
We're all just trying to keep things running for those who rely on us. That's why we don't have time to be sick with the flu.
We don't have time for delays.
We don't have time for spills.
Next.
We don't have time for setbacks. Let's be real.
Getting the flu shot
Helps you fight the flu.
Get a flu shot for yourself and those around you too.
Welcome back to Talking Fitchburg. We're in the guest segment today. Fact TV is the guest, and I'm about to break some news that you all want to know about Fact TV. No, I'm not leaving. No, Andrew's not. None of the staff are leaving. We're good on that front. Maybe I'll be kicked out eventually, but till then, you're stuck with me and Bamlet as well. Maybe Bamlet will take over and I'll be doing what Andrew does. Probably not, but I'll keep wishing. No, we're going to talk about Fact TV. We've got some big changes coming for you, and it starts with this. Changes are coming to Fact TV with our media channel. We are going to be retiring the media channel. That's right. F1 the media channel will be no more. The community bulletin board will continue on, though. It continues on. So you're not losing it. What you're losing a channel. And you'll still see the bulletin board from time to time on the Com channel and Gov channel, just like you always have. So you're like, okay, so you're getting rid of F1 the media channel. Well, what's going to happen here? You have F2 and F3, right? Well, we're changing the government channel to priority number 1. That's right. Meet the new F1, the Gov channel. What's happening? Nothing's really changing, just the F1 from F3. That's really what the change is here. So F3 moves to F1, the Gov. Yep, F1 Gov is all meetings all the time, like it has been. And F3 channel will not be replaced. So we've gotten rid of the media channel. We're keeping the Gov channel. We're just moving it up to F1, the Gov channel. So you can find, as usual, you'll be able to stick with this. You're going to be able to find everywhere, or find the Gov channel everywhere that you were before. But you're just looking for F1 instead of F3. I know it's going to take some time, but our government channel is important. The media channel was just the community bulletin board. So we're trying to save our resources and continue to provide the best content that we can and information. What we're doing, though, is cutting down to 2 channels. We'll save on some equipment costs, but we're also streaming our channel. So we're providing 2 channels on cable TV, but we continue to stream all of our content out there. And that's the direction that we know this has been going. We've been streaming since 2010. When I first walked through the door, we just started to stream then. So we'll continue to do that moving forward. So meet the new channels, F1, F2. It's as simple as that. It doesn't get any better than that, in fact. And yeah, the Com channel stays the same. No change there. We put the government channel as number 1, and our Com channel stays the same. And like I said before, all of these channels are available. These 2 are available on Apple TV, Roku, Amazon Fire, streaming, and your cable channels as well. We're just going down to 2 channels instead of 3. So it doesn't really affect too much as far as how you're watching it. We're just not having a dedicated channel to the community bulletin board. You still have access to the community bulletin board, and we're going to still give you updates to the community bulletin board. So take a look. This is the community bulletin board. It doesn't change. You'll find it on our 2 channels, F1 and F2, Gov and Com channel, when we do make the switch. So let me give you the updates here of what you're seeing on Carousel currently. Well, I call it Carousel, but it is the community bulletin board. Andrew, correct me when I say that, because I tend to do that. Blackhawk Church Blood Drive, that's circulating out there. It's happening Tuesday, January 25th, tomorrow. Make your appointment if you haven't done so already. Hey, what is this? Radon? Is it Radon month or something, Andrew? Well, here's where radon comes from. A great graphic here. And I really encourage you to check epa.gov/radon. It has so much great information. If you're still like scratching your head like I am, like, do I not do it? Do I do it? I'll tell you, this will get you thinking twice about why you should be doing it and should be running those tests. So definitely get involved on that. Free tax help, that's still available out there if you haven't signed up already. This is where you can find it. Register at signupgenius.com/go/RDTC. For more information, it'll be at the Village on the Park at UW South Partnership Office, 2238 South Park Street in Madison, and it's free for everyone. Beware of fraud and scams, and make sure you report them. We got to stop this. This is like the top crime out there, don't you think? And we need to stop them. The only way to do it is report it. And this one's talking specifically about after disasters. Certainly, there are a lot of scammers after disasters. We've talked about that, but you need to report them no matter what it is. And finally, Town of Madison, we're going to be talking more and more about this as the Town of Madison attachment. Yeah, we're coming together as one by the end of the year. In fact, October 31st. Happy Halloween. What a great Halloween we're going to have this year when Fitchburg and the City of Madison will be taking over different parts of Town of Madison. We're trying to get the information out there. We got a lot of great information coming, and we've been working very hard behind the scenes. So we'll be talking more about that. But that's where you can start finding some of the information. Fitchburg.wi.gov/Town of Madison. And you can find out those of you who live in Town of Madison will be joining us. That's where the information is. And finally, a blood drive. There is a crucial need for blood still across the United States. And if you want to land some Super Bowl tickets, you might want to sign up now and donate so you can get involved in that drawing. All right, jumping over to the Gov channel, F1. Ha, that comes first now. Can you believe that? There's where you can find all of the Gov channel and its great properties. That information there is on your screen. And you know, we cover the meetings. We're there for you 24 hours a day, 7 days a week, covering all of your meetings live and rebroadcasting them. You can check it out there on your screen. And then moving over to the community channel and previewing February as we get closer here to February. We've got our regular Talking Fitchburg lineup for you. Not too much as new stuff coming in. We do have a D1 All-Stars coming up, Conversation Shop coming up. Rowan area high school sports, we've been taking kind of a break with COVID numbers being high to protect the staff and students. So we'll continue to provide those as they come up. And of course, enjoy the new channels as we've got you. Well, we're just excited about this change. And we'll have more to come as it gets closer. All right, that does it for me. Need to wrap up the show. Enough of Jeremy. We'll be right back.
See on page 4 that the projections need to be blood. Next Thursday?
Seriously? Thursday? Can't do that.
This is really inconvenient.
I have yoga that day.
I have no time for this.
So.
I can't do Thursday, but I can do Friday.
Disasters don't plan ahead. You can. Talk to your loved ones about how you're going to be ready in an emergency. Don't wait. Communicate.
If you love them enough to suck the snot out of their nose at 4 a.m., then surely you'll check nhtsa.gov/the right seat to make sure they're in the right car seat.
Welcome back into Talking Fitchburg, wrapping up the show for the day. I've had a lot of talking today. But I'm really happy to share some great information with you. And you want to find out more information about Fact TV? Andrew's got you covered. We're going to have to update this graphic. You know that, Andrew? Darn it. Put this on your to-do list, okay? He says okay, but really it's me who's going to have to update this, I think. We want you to join us, follow us, and enjoy your shoveling.